Hi, I'm Dr. Sridhar Kalyanasundram. Welcome to my channel. I hope you find these videos useful. And one of the colleagues who is working in Egypt at the moment had contacted me about a very stressful situation. This was a case where the baby was not responding to whatever measures they were doing, and finally they lost the baby. So this is not an uncommon scenario in a very busy level 3 NICU or a smaller NICU, which often faces smaller babies. And this is even more common in the developing world, where we have constraints related to how much we can do to care for the baby. Cost constraints may be there. Availability of certain equipment may be a limiting factor. Availability of medications can be a limiting factor. So invariably there is a mixed feeling within the team. Everyone is frustrated, everyone is upset. Many of us are very sad about the loss, and obviously the frustrations come in, especially if anything could be done different or better in this scenario. So the first thing is to recognize, or during the course of the acute phase, recognize that every team member has something to contribute. Make sure that you listen to everyone who has something to say when we are managing a very sick baby. I mean, obviously, it may be very evident to some of you that baby is not going to make it given the course, and you may have seen similar cases in the past. It may be a very severe acidosis which is not responding to management, a very severe hypotension which is not responding. The oxygenation may fail in such babies as well. So if you have such scenarios, obviously you know that the outcome is very poor, and you have to take the team along. There may be members in the team who want to try something to try and save the baby in these situations. So there is always a good opportunity to discuss at that time, so we don't feel later on that you miss something. So even if you're a junior member of the team, or if you're a nurse on the team, feel free to voice your opinion, be heard. And obviously if someone doesn't listen to you, it's one of the points to debrief later on. But don't show your frustration in that immediate acute phase. There are certain things which may help, and of course if you do it despite all the measures, some babies do not respond. The whole team works together, and the family is part of the team as well. So we have to involve the family, keep them updated that things are not going in the right direction, and try your best. Obviously, we have to recognize that despite the advances in medical management, not every single case can be managed successfully. There are situations where you recognize that what you're doing is not giving a benefit. The baby is bound to have a negative outcome. In those cases, you have to recognize, and if your country laws allow you palliative care as an option, you can discuss that with the family. You don't need to aggressively push the intensive care, either because the neurodevelopmental outcome is definitely going to be poor, or the chances of survival are very slim. So you have different guidelines from different bodies around the world: no hope situation, futile situation, and so on. So you have to discuss within the team whether you have reached that situation, and then take it from there. Of course, like in the UAE or other countries in the Middle East, you have limitations on what you can do in end-of-life care. You have to be very careful about withdrawing support, because that's not legal here. If the baby does pass away despite your efforts, if the heart rate is not picking up during resuscitation, there may be a situation where you may need to call off the CPR as well after 20 to 30 minutes of effective CPR. Despite the use of medications, if the heart rate stays 30 to 40, it's not really a return of spontaneous circulation, and you have to call it a failed resuscitation. Once a resuscitation is done, we deal with the family first, explain to them, make sure the baby is given all the respect that's due, the parents get time to spend with the baby, and then we arrange a team debriefing immediately, and a team debriefing and a parent debriefing at a later date. So both are important. The immediate debrief is for people to acknowledge each other's concerns, to make sure everyone doesn't feel that they miss something, and if there is anything that can be done better, it's always left to discuss in the future meeting. This future meeting is very important. You go through all the events around the around the last few minutes or hours of death, and review the information that's available in the file, review the documentation, review every action, and then think about whether anything could be done different. It's good to have a mortality meeting where you present the case, as a formal presentation, and the presenter explains the points. It may be someone not involved with the management, so it becomes an unbiased discussion. And then you discuss within the team what could have been done better, and so on. So this is just an overview. Mainly go together with the team, involve every member of the team, make sure everyone is heard, and make sure the parents are involved in these in stages when we know the outcome is not good. And if your local system allows you, give the option to the parents on what they would like to be done in these situations.